Hi, my name is Vincent. I'm going to be your nurse today. Can I have a name and date of birth?
Faith Neighbor, March 6, 2002.
Alright. Do you have any allergies?
Penicillin.
Penicillin? Okay. So I'm going to drop back the curtain. So today we're going to be doing a health assessment, full body health assessment. We're going to go through all the body systems and just see what's going on, just make sure there's nothing out of the ordinary. And yeah, so the first thing we're going to start with the skin. So, let's throw some gloves. So looking at it right now, I'm not seeing any lesions, no moles, no scars, no redness. So I'm going to take a look. Odor, not noticing any odor. It is currently warm. I'm going to inspect all the structures. I'm not seeing any skin breakdown. And yeah, so next I'm going to go for skin turgor. And it recoils immediately. While I'm here, I'm just going to do capillary refill. And it's less than 3 seconds. And I'd also do your feet too, which are also less than 3 seconds. So next, we're going to go to the head and neck. And also skin is smooth. So head and neck. So I'm looking at symmetrical. I'm not seeing any different types of any lesions, any moles, no drooping or anything. So I'm going to go feel. So shape, it is round. It's not tender. You're not feeling any pain. Okay. I'm not seeing any lesions, no masses, no tenderness. Okay, then we're gonna move on to the lymph nodes. So I'm gonna start with the preocular. So we're just here, move behind to the postocular, occipital, okay, then submental. Submandibular. Sorry, I'm messing up your head. Submandibular, tonsillar, thyroid down here. Move on to the chain. Then deep cervical and then posterior cervical. So here. Okay. So I didn't notice any I couldn't feel any. There was no tenderness or any type of pain when I was doing that. Alright, cool. So next we're going to go assess the trachea. So I'm going to press against here. Do you mind just swallowing for me? Good. And then this side too. You're good. And I'm just going to assess the rings of the trachea. Here. And I'm also feeling the thyroid. And that's good. So skin. So lymph nodes. Next we're going to go to the eyes. So your eyes. I don't see redness from here. They're symmetrical. I'm not. They're aligned. I'm seeing no side of strabismus, conjunctiva. So I'm just gonna take a look. Show you my light. So your conjunctiva is white. I'm not seeing any. Actually, I'm not gonna pull this down actually. So your conjunctiva is red, both eyes. Sclera is white, and your cornea is. It's there. No, that's good. I'm just fine. But yeah, that's good. Next, we're going to go to your red reflex. So, if it works, so you just mind just looking at me. So we're going to go here. And it's present in that eye. And it's present in that eye. Cool. So, let's go back here. So reflexes. So next we're going to do some pupillary tests. So we're going to go direct. So just look at me. And this pupil is responsive. And this one is also responsive. Then we're going to go to the consensual. So I'm going to flash it in this eye. And that one also is consensual. That one also goes constricts. And this one constricts too. Cool. So your eyes, your consensual reflexes is present. Then corneal. So I'm just going to go here. Good. Good. And then we're going to go to convergence. So just look at the light here, and then we're going to go. Perfect. And then accommodation, and your eyes do accommodate. So you're good. Next, we're going to move to the ears. So just looking right here, I'm not noticing anything abnormal. There's no lesions, there's no masses. Are you feeling any tenderness or pain? All right, so I'm assessing the auricle. Yeah. So it says the targus, so right here, and the mastoid in the back, and it is colored. The color is same as the rest of the body, and externally it looks good. So next I'm gonna get my otoscope. I'll take a look at your ear canal and then go into the eardrum itself. So I'll look from the outside. So right here, ear canal is pink. Serosudum is I'm not seeing any there. There's no odor and no drainage, and the tympanic membrane is gray. Okay. Then we go to the other ear.
You want to go back there?
Oh, okay. Thank you. So, looking at the ear canal, it is pink. I'm not seeing any drainage. Serosudum is there, and the tympanic membrane is gray. Not seeing any drainage or swelling, and that's good. And your ears are symmetrical. They're in proper alignment with your face. So just check. So your canal is good. Your tympanic membrane is gray. There's no discharge, and it was odorless, and I didn't notice any swelling. Next, we're going to do the whisper test. So I'm going to go on this side, and the opposite ear, just cover it, and just repeat back the words that I say. So I'm going to say three letters and just repeat it back to me. So R-P-W.
RPW.
Perfect. And then we're going to do the other ear as well. R-P-W.
RPW.
Perfect. All right, so hearing is intact. And so next we are going to assess the face. So inspecting it, I'm looking at your face right now. It's symmetrical. It's also round, and I'm gonna feel it. So it's also the same color as the rest of your body. I'm not noticing any lesions, scars, or moles, or any type of swelling. So we're gonna go for the frontal sinus here. You feel any tenderness or pain?
No.
All right, it is not tender. Then we're gonna go frontal here. Any pain or tenderness?
Mm-mm.
All right, perfect. So, and yeah, so muscular sinus. So next we're gonna inspect your lips. So your lips look pink, they're symmetrical, and I'm not seeing inflammation. I'm gonna look inside your mouth, so you want to just stick your tongue out for me. So do you have your tonsils? All right, so they're pink. I'm not seeing any inflammation or swelling or lesions. Soft palate and hard palate are there. I'm seeing any lesions or anything. The swelling, they're intact. Gums, you mind just pulling your lip down for me? Good, they're pink. And yeah, so, and next I'm gonna look at your tongue. So just stick your tongue out. Good, and then stick it up. Perfect. And then tonsils. And then you smile for me. You smile.
Oh, I thought you said swallow. Sorry.
Oh, no, you smile. Good, and then can I see your bottom teeth? Perfect. So all 32 teeth are present. They're aligned. They are white, and I haven't noticed any fillings or anything. So yeah. So tonsils, hard palate, up and down, mucosa, lips, and yeah. So next we're gonna move on to the lungs. So I'm gonna look at your chest right now. I'm just normally breathing. It is symmetric. I'm not noticing any increased respiratory effort, and yeah, and the shape is normal. I'm not seeing any barrel chest or anything. So you might just breathe normal for me. Good. So I'm just gonna feel back here. So I'm gonna get my thumbs in the way back here.
Do you want to turn them?
Sure. So I have my thumbs here. Can you just breathe in all the way for me? Good. And then back. Perfect. So a full lung expansion, and then we're gonna take a listen. So once we're gonna feel around, actually I'm gonna feel first. So do you feel any tenderness or pain?
Mm-hmm.
Okay, I'm not noticing any masses or lesions in the back. And there's no tenderness. Tenderness and expansion. So next we're gonna percuss. So I'm gonna bring it back again. So you're on the thing. So we're gonna do it 10 times. So and there's no tenderness, and the organs seem to be in the proper place. So next I'm just gonna take a listen. So every time I move my stethoscope, just take a breath.
Okay.
And we're gonna do that for 10 times. Okay, lungs are just clear and present in all lobes. Not noticing any crackles, any bronchi, or any diminished lung sounds. So we're gonna listen to the front now. So again, just same thing, just every time we move, let's go just take a normal breath. We're listening to every breath cycle as I move it. So. Okay, then as soon as you decide, you just lift your arm up for me.
Yeah.
Thanks. Okay, I'm gonna do this side. Good, same thing, no diminished lung sounds, and they're all present in all lobes. So we're gonna do that, palpated, we did that. All right, next we're gonna do cardiac. So looking, I'm not seeing any lifts or heaves. I'm gonna lie you back and inspect. So you mind just lying back for me? I'm just gonna put your feet up. So. Then I'm gonna put you back. So I'm just gonna put my hand on your chest here. I'm gonna feel if there's any throw, which I do not feel. And would you like to sit up or you like to lay down when I assess your heart sounds?
Whatever is easier for you.
We'll sit back up because you don't look comfortable. Let's back up. So I'm just looking at I'm gonna look at all the valves and see what we can hear. So we're gonna start with the aortic. Pulmonic. Tricuspid. Mitral. And I'll be also doing this with the diaphragm. Do both sides. Pulmonic. Tricuspid. And mitral. Okay. So that's S1, S2 as well. There's no friction rubs. I didn't notice any murmurs and regurgitation. And yeah. So, okay. And I would be doing that for 20 to 30 seconds for each valve. All right. So next we're going to do your extremities. So again, looking at your skin is looking pink. I'm not noticing any cyanosis or pallor. It is warm to the touch. So next I'm just going to assess your pulses. So we'll go radial. And it is smooth and pigmentation is same throughout. No brachial. Carotid. And carotid again. So upper extremity pulses are +2 bounding. I'm gonna assess for edema as well. So I don't notice any. There's no swelling, and yeah, they're both are bilaterally equal. So then I'm gonna assess your feet. So I'm gonna put your feet up. You can take your shoes off as well. And so it's Turger and cap refill at the beginning of my assessment. And that's when I do pedal pulses. So I don't know if you can see in the video. So I'm just gonna put your feet up just to make it easier.
Okay.
So okay. So pedal should go here. Pedal pulses are present. And then I'm gonna feel for any edema. And color is again pink. There's no swelling. Then I'm gonna go up to you. Okay, perfect. So I'm gonna put this down right here. I should probably put back so we don't abdomen next, but we'll work with that. So yeah, so trigger is good. I'm not noticing any pedal pulses are present and it's +2. And I didn't notice any edema when I was feeling around. And skin color was pink, temperature was warm, pigmentation was same as the rest of the body, and texture was smooth. So we're gonna go to abdomen next.
Okay.
Again, I'm gonna have to put your feet up, I'm sorry.
You're good.
But do you mind just pulling up your shirt for me? Perfect. So looking at it right now, I'm not noticing any lesions or scars. It is smooth. And then I'm gonna listen. So I'm gonna listen to each quadrant 3 times until I hear a vowel sound. Perfect, vowel sounds are present. You're not feeling any pain or anything when I do this, right?
Mm-mm.
Okay, good. So next I'm gonna percuss. So we're gonna start here. So we're gonna do again 3 each quadrant. Perfect. So, and then we're gonna percuss as well. So I'm just gonna feel around. If you feel any pain or anything that's bothering you, just let me know.
Okay.
So I'm not feeling any masses. It is non-tender. No quadrants. So feels good. So next we're gonna sit you back up. So put this back in for you. Put this up. So I'm gonna assess your spine first. So you just stand there. So I'm gonna feel up here. So we're gonna go cervical, thoracic, lumbar, coccyx. Yeah. So if you want to just stand up for me. Just have you bend over. Good. Again, it is straight and noticing any lesions or tenderness and yeah. All right, perfect. So you can sit back up for a minute. So I'm next gonna just all your joints, see if I notice any tremors or anything. So I'm just put your hands out. So I'm just assess your joints. I'm not feeling any swelling, no tenderness, no warmth. Joints here, feels good. And then knees, and then feet. If you want to just do your feet a little bit, yeah. Thanks. And you're feeling no pain, right?
No.
Okay, good. So I also All joints and extremities are symmetrical. I notice any deformities. There's no tremors. Color is same as the rest of the body. It is pink. And it's not warm. I'm not feeling any extra warmth or coolness, and there's no swelling. And I didn't notice any tremors as well. So next we're going to assess your TMJ. So you want to just open your mouth for me? Then clenching. Perfect. Then can you move your jaw to the side? Perfect. Against my hand. Against my hand there. Against my hand there. Perfect. So that's intact. So then we're going to go to the shoulders. So can you just press against here? Perfect. And then, are you having any mobility issues? Are you able to move it above your head? Can you show me?
Yeah.
Perfect. All right, cool. So, and no pain as well, right? Okay, so elbows. So can you just push against my hands? Push down. Then move out against my hands. Then move in. Perfect. Then we're going to go to the hips. So, let me make sure I have everything. So actually, no, we'll go knees and we'll go hips. So can you just stand your legs for me? Good, good. And can you push down on them? Good, and push up. Perfect. And then we're gonna do your hips. So, down. So we're gonna start with your right leg. Can you extend it all the way out for me? Then to your chest, then out, back in, and straight out again. Good, and then same thing with this leg. So it's out, back in, out, back into the middle, and extend. Perfect. And no pain or anything when you do that?
Mm-mm.
Okay, so you extend your, can you push your legs out against my hands? Good, and then in. Perfect. All right, so strength is intact, so now I'm gonna sit you back up. And the last assessment we're gonna do is a neurological assessment.
Okay.
So we're gonna do finger movements. So can you do your finger to your nose for me? So like this. Oh, sorry, from here.
Yeah.
Sorry. Good. And then same thing with that hand. Perfect. And then can you do your thumbs to your palms? So or thumbs to fingers. So right here. Then back. Good. And then can you squeeze my fingers? Perfect. All right. So next we're gonna assess your reflexes. So I'm gonna assess your bicep. So camera. So press here. Good. Good.
I shall
Felt it?
Yeah.
Alright, then we're gonna do patellar, and which you can see here. So just let your hang loose, like I don't have tension. And then perfect. One more. Right here. Perfect. Good. And then so next we're gonna assess your dull and sharp. So I'm gonna have you close your eyes. I'm gonna either give you a dull or sharp. You're just gonna tell me what you feel. So we're gonna start with your face, hands, and then move to the feet.
Okay.
So just say what you feel.
Sharp.
Good.
Sharp. Soft. Soft.
Good.
Soft. Soft. Sharp. Sharp.
Okay. Then actually, I'm gonna put your feet up for this.
Yeah.
So good. And then
Soft. Soft. Sharp. Sharp.
perfect. All right. So your feet up. I had you grip my hands. So next we're gonna go through the cranial nerves. So first we're gonna start with the olfactory. So so can you close your eyes for me? As tight as you can. Can you squint your face? Smile. Frown. Perfect. So cranial wait, close your eyes, have vision supposed to be. Alright, so that's not cranial nerve number 1, but we'll come back to that later. So actually we're gonna just close your eyes and smell something. So can you just tell me what you smell?
Coffee.
Good. Alright, so cranial nerve number 1 is intact. So next we're going to do the cranial nerve number 2, so optic. So I'm going to have you close one eye and then read the numbers right above the red line.
DEFPOTEC.
Good. And then other eye?
CETOPFED.
Good. Cranial nerve number. Oh, good. Cranial nerve number 2 is intact. So next we're gonna do 6 cranial fields of gaze. So this is cranial nerve number 3. So just follow. So without moving your head, just have your eyes follow the top tip of the pen. So up, down, down. Perfect. Cranial nerve number 3 is intact. Next we're gonna go trochlears. So we're gonna, like we did this before, but we'll do it again. So we're gonna see that your eyes constrict. Good. Good. What should I do? All right. So cranial nerve number 4 is intact. Cranial number 5. So we did this before, but we'll do it again. So could you clench your teeth for me? Could you? I should feel that. You clench. Perfect. And then could you? I feel the jaw. Open mouth. So I want to have you open your mouth, please. Good. Cranial nerve number 6 is intact. Number 5. Number 6 is we're gonna go. This is convergence. So we're gonna go here. And we're gonna go right to your eyes. Good. 6 is intact. 7. So can you close your face tightly for me? Yeah, it's like squint your face.
Okay.
Good. And then smile. Frown. Stick your tongue out. Good. And make sure you don't miss anything. And puff your cheeks. Good. So cranial number 7 is intact. Cranial nerve number 8. So I'm going to occlude one ear, and I did this before. We did the whisper test. That is intact. You repeat all the letters correctly. 9. So I'm not doing the gag reflexes, but I noticed. So can you say ah for me? That's good. And you have no problem swallowing, right?
Mm-hmm.
All right, good. So cranial number 9 is intact. Number 10. So and you're able to swallow. Can you swallow for me? You're not having hoarseness or anything when you talk or any problems. Good. Can you move your head side to side? And then can you shrug for me? Good. No, it's just shrug against resistance. And then can you look left? Wait. Can you look towards my hand? There you go. And look at my hand here. Perfect. So cranial nerve number 11 is intact. And the last one is 12. Can you stick your tongue out for me? Side to side? Perfect. And yeah, actually, I'm gonna assess your nose too. So I didn't forget that. So, so again, looking right here, it is symmetrical. I'm not noticing anything out of place. So I'm just gonna palpate. There's no lesions, no tenderness, no masses. Good. That is symmetrical, so I'm gonna set your septum. Good. Changes the arms. Good. Just look. So, color is pink. Not noticing any discharge or drainage. Good. And next we're gonna assess the nasal patency. That's the last thing. So could you cover one nose and then blow out for me? Or blow it. Okay. Good. And you have any problems with that? Good. All right, perfect. So I'll make sure I didn't miss anything. So assess lung to the cardiac. I don't see these are scars. Such a thyroid. All right, so that's all we're set today. Do you have any more questions? All right, perfect. Thank you.